Welcome everyone to our Youth and Mental Health webinar today. We have two members of our behavioral health team with us. On the left, we've got Kim Sundling, and Dr. Kim Sundling is a board-certified psychiatric pharmacist. She's got direct and indirect clinical care experience. She's the behavioral health clinical pharmacist at Florida Blue for both commercial and Medicare members. And then on the right, we've got Debbie Del Rosario. She is a licensed clinical social worker with 25 years of clinical experience in direct and managed care environments. And she is the Senior Director of Behavioral Health Clinical Programs here at Florida Blue. And with that, I'm going to turn it over to Debbie and Kim.
All right, well, thank you everyone for being here on this really, really important topic and something here at Florida Blue that we really care about. And our hope is that we'll be able to raise some awareness about what our youth face day to day and just really be able to apply it to your guys' life, whether you have children of your own, whether you're a grandparent, foster parent, whatever makes you a parent in some way, aunt or uncle as well. So before we get started here, I do want to state from the start, and we will repeat this when we get into the question, answering your guys' questions that you posed today. We will not be answering any direct patient or direct child examples of cases that you have been dealing with. There's a multitude of reasons for that, one of them just being safety, as Debbie and I do not know their medical records or what has been done previously, so we cannot safely give clinical feedback on that. And we will say this later on, so if you do not have one of your questions asked, that could be why we are not answering it today. So with that, let's go ahead and get started. So I just want to first present some depressing or some kind of sad data. Unfortunately, our youth, their mental health is not the greatest when you start to look at the trends over the last really decade, I guess. So looking at the screen or the table here that you're seeing on the slide, this is a survey that is done for high school students, so grades 9 to 12. And this is a youth risk behavior surveillance system. It's abbreviated YRBSS. And it is done by the CDC. And it really looks at a wide variety of categories that are really important when thinking about the youth mental health. And you can see on the screen just the level of change of these categories over the years, especially just looking at recently at 2021. One thing that I really want to point out is that first row, that is 42%. I should have said these are in percentages. So 42% of the youth that was surveyed has experienced persistent feelings of sadness or hopelessness. And this is due to a wide variety of reasons, which Debbie will be covering later on today. But, you know, when you think about what the youth is facing today, I mean, think of bullying, social media, and just some of the pressures that are put on our youth and what is deemed to succeed or what is successful in the eyes of the youth. So I think it's really important to think about those risk factors. And you'll notice that there was a pretty big jump between 2020 or 2019, sorry, and 2021. You can see that there was a big jump, like I was saying. And there is thought that the pandemic obviously contributed to it. I mean, it contributed to a lot of mental health stress and things like that for really everyone in the world, but this isn't the only reason why these things increased. And like I said, Debbie will be going over some of these factors later on. But what I really want you to take away from this is that this is something that if you are a parent, you're an aunt and uncle, you're a caregiver, you're a teacher, you're a counselor, whatever your role is in our youth lives today, it is important to realize that mental health really should be at the forefront of some of the things that we're thinking about when we're caring for our youth today, because the trends don't lie. There is nothing that is moving in the right direction when you're looking specifically at this survey. So I just really want to make that point clear that we can make some difference in this. There are things we can do, and I know I've been talking about Debbie a lot, but we will be covering this later on in the presentation today. And what we really should think about too is when individuals have poor mental health, they are likely not going to have the best health as well, and it also increases their risk for certain things later on in their life, such as drug use, HIV, unintended pregnancies, STDs, and things like that. So mental health is incredibly important in all areas, adults, youth, but especially in youth, because it sets them up for some things down the road that are not necessarily what we want to happen if we can avoid it. So looking at this slide, I kind of talked a little bit about this, but just really want to hit the point home that 1 in 6 youth, meaning age 6 to 17 in the United States, experience a mental health disorder per year. And I just want to point out that this is for people that have a mental health disorder. There is another statistic out there for individuals that have an undiagnosed mental health disorder, but it's quite outdated. So I didn't want to put that in here, but just know that this is for people that have a mental health disorder. And untreated mental health disorders lead to a lot of different difficulties later in life. And you can see the 3 there that you think about or that they may experience as a young adult or just even later in their high school years. So dropping out of high school, increased risk of suicide, increased risk of juvenile offenses. And one thing I just really want to point out here is that if you address mental health concerns early, the less likely they are to have the difficulties later on in life. So it's really important to pick up on these symptoms and things like that, or just being aware of individuals' risk factors. And I will be covering that later on. But I think this is just really important to kind of let soak in, because oftentimes we don't think maybe that these are common. And that statistic up there is pretty startling to me, and I think it's just important for you guys to understand what our youth is dealing with today. So with that, I think it's important for us to understand why these numbers have increased, and I'm going to pass it off to Debbie.
Thanks, Kim. Yeah, just as Kim was indicating, kind of when we're looking at the why is this increase, I think it's interesting or kind of important to recognize that, kind of things are different for this generation of kids. I actually saw a quote fairly recently that really resonated with me that says that, don't raise your children the way you may have been raised, because the world you were raised in really doesn't exist anymore. It's completely different in many capacities. When I think of some of those changes, this generation, some of the increases or impact of stress that may be placed on these children and individuals is a couple of things. One, I think of social media. That was not even a thing when I was growing up or concerned, so not even a concern or indication. And the children today, though, are constantly surrounded by social media. They are seeing that influences and things that may be impacting kind of their identity and who they are. And I'm actually going to go into that just a little bit more distinctly, because social media is such a unique impact to our individuals today. The pandemic impact, again, for at least a year, children were moved out of their normal routine, and routine is kind of critical for especially as children are learning about their things that they are doing differently. And by moving outside of that routine, their normal interactions with their other friends or how to socialize, just during those unprecedented times, we didn't know what we should do or how to address stress and fear. And I think some of that impact of that time has caused some adjustments with the children. So milestones, developmental learning that may have impacted or been supposed to occur with children during that time could be shaped and look differently as they are today. When you think about stress that children are going on, there is a high increase in certain expectations, certain levels of what kind of individuals they are supposed to be, especially thinking of how they should be excelling in school or certain components of sports or activities that they are doing at that time. So feeling that compounding of it. And then lastly, bullying. I think bullying has been around for a while, but in these days and in this time frame, it looks different. I think in many ways it could be more intense. There could be more vicious impacts as these trolls or attackers are doing, because they are hiding behind that anonymity of being faceless online. So that impact and how all these blocks, I think about these blocks resting on our children's shoulders, causes, kind of an impact to their mental well-being. And being able to identify how they can cope or work through that is where we're all here and why we are looking at ways to helping change that conversation. So to that end, one of the things I think is important just to kind of think about is the psychological development that are typically around children during these time frames. So a world-renowned psychologist, Erik Erikson, created a fundamental way of looking at the psychosocial development of individuals. So he looked at, there's a total of 8 stages, and looking at individuals from individual to at birth to maturity, what should be occurring during each of those stages. And as you are going through life and hitting these different milestones, once you have been successful in completing a stage, that helps serve you in that next level of your life. And again, kind of projecting how you will be able to improve interactions, how you are able to interact with an individual. So looking at things that may occur at certain stages of your life is important. So if you're succeeding, you'll have great strength and, again, have a positive psychosocial ability, positive sense of self. But if there is some struggles or some failures, that could potentially cause some ability to build that strong self. So highlighting or looking at that with our youth with this middle school age time frame. We think about most of the things that happen in that middle school time. These are when kids are learning what are they capable of doing, what are they able to achieve. This is the basic skills, so reading, writing, arithmetic. They're learning about art, defined motor skills, tying their shoes, maybe playing certain sports, and all these achievements is helping build their level of confidence. It's building that sense that they are able to do something new and individual. And as they're looking at these social interactions, whether with their peers, with their teachers, even all those opportunities to show, hey, look, I'm doing this great, helps build their ability of feeling like they can achieve new things. So that's why I know my kids were always so excited about showing that gold star, or the smiley face on their positive behaviors that they've received from their teachers. And that kind of, again, resonated in helping build their self-value and their self-image. And so during that stage, it's really important to have, that encouragement, and they feel that they are able to be successful in the skills that they have and being able to achieve it. In the teenage years, this is where a shift kind of during that time frame, or the main focus in the teenage years, that 12 to 18 time frame, is where they're trying to figure out where do they fit in. They are trying to seek that social relationship, how to create that identity that is unique with them. So they're moving from that middle school to a high school environment that, again, has new influences, new individuals that they may be interacting with, and they're trying to identify, their own belief systems, kind of pressure testing some of their ideas. That may be why they are engaging in different clubs, different sports, different activities, different programs. And a really time for they're doing that personal exploration to, again, kind of build who they want to be and who they want to connect with by during that stage, it's really critical to also identify getting that proper engagement or encouragement, saying, good things that they're doing, or maybe kind of molding them to maybe shifting to something that's not as toxic, or things that are negative, and moving them into a positive area. So these are important capacities to help identifying during those two stages, building the capability that you can do things, and identifying who you are during those stages is very important to have. So thinking about from a social media perspective, and this is a new entity, and this is a new thing that we're all seeing, that social media can truly impact that psychological development of our kids. One side, and I know normally social media gets a negative indication, but there's some positivity of that. There's many opportunities, especially during the time when we were at the pandemic, where kids were isolated at home. These social medias build that ability to connect with others that they couldn't get to because they weren't in their social circles. And it also builds that ability to showcase your uniqueness. You've heard of people being discovered or indicated on TikTok or different capacities, that they can show that they have something unique that is outstanding, that sets them apart from other individuals. So again, building that identity we just referenced. But sometimes there's also that ability and that positivity. It just relieves stress. Kids are feeling the pressures on their shoulders, having a moment to look at clips, seeing their friends doing something, bringing a smile to face. So there's great opportunities from that way of building it. Unfortunately, that negative side, or that other side of the coin, is showing that there is a significant downside of social media. There is the sense that when seeing a view outside, the mindset of the individuals are looking at that they are fear of missing out on something. And by having this awareness, seeing their friends or family doing things without them, they get that FOMO, that fear of missing out, of not being included, and they internalize potentially that is a tie to their self-worth. Why was I not included? Why was I not asked to be part of that thing? So they have that negative thought process and how to manage that. They feel sometimes that they have to present a specific view to the rest of the world, that by putting things online, they can only represent the most positive side of themselves, that perfect self that does everything right. And again, that feeling of that pressure, and that, oh yes, this is what everybody likes, I got X number of followers because of this, puts that perception or that anxiety on them that they have to be something that they cannot sustain. No one can sustain that. It becomes overwhelming at that time frame. So these are things to be considered as you're thinking about the kids and what they are going through. They're having because of things such as social media, their thoughts of what they are excelling at might be questioned. Their feeling of belonging and who they are might be questioned, and just trying to figure out what are some right ways that we can do flooring. So passing it to Kim and to talk about some of the risk factors and protector factors that we are helping with our children.
Thank you, Debbie. That is super helpful to kind of understand why these trends are happening and just how things have changed over the years, and just the impact that it has on our youth, and, if you think about it, our adults as well. So I'm going to next go over risk factors and protective factors. And I want you to kind of look at these, but also think that this is not an all-inclusive list. So there are maybe things that you have seen, maybe you yourself have experienced in your youth that could potentially lead to a mental health diagnosis, or just really any mental health difficulties. So having a risk factor just means that these variables that you're seeing on the screen, it can increase the risk that they may have a mental health difficulty, mental health disorder. It doesn't mean that if your child or the youth that you are thinking of has these things that they're going to have a mental health disorder or a mental health difficulty. These are just, when you look at the studies and look at the data out there, that these are some of the more common ones. Like I said, there are more that are not listed on the screen, but these are just the ones that I'm going to be sharing with you today. And looking at the risk factors, we know that mental health is a very complicated topic. And what I mean by that is there's not one cause of a mental health disorder or one cause of a mental health symptom. There's genetics, there's internal factors, there's societal factors, there's community. There's even just family factors that really can increase the risk of a mental health difficulty down the road. And you can see there's a wide variety, but I'm just going to point out some on here. By me pointing them out, it doesn't mean that that is the more likely one to cause these difficulties, but just more want to call some of them out. So internal. These are probably a little common sense when you look at some of these, but health problems. A child that has significant medical difficulties, mental health difficulties, they're going to be missing school. They're going to be they're going to be different than some of the other youth around them because of whether they're missing school or maybe they have a disability. Unfortunately, with bullying and stuff like that, that can really cause differences in how the youth think about that individual person. Family, definitely if there's difficulties at the home, this can really impact a child. And also I want to point out if someone has a parent that has like bipolar disorder, schizophrenia, depression, anxiety, they're more likely or they're higher risk for having a mental health disorder themselves. And then community and societal, looking at those, I'm sure most of those make sense. That's been the same for a very long time. But those are just some of the risk factors. So these are things that if you think about and you understand for the youth that you're thinking of or your child, your niece or nephew, this is something that you can work with the professional, so the mental health professional that you are working with, to figure out if your child is at risk or the youth that you have involved in your life, maybe that is contributing to some of the mental health difficulties. And we will talk a little bit later about how we can help with some of these factors and how we can better improve some of them to help your child down the road. So next I want to look at protective factors. So this is the exact opposite of what I talked about with risk factors. So these are things that in a child's life, if they have these present, they are less likely to have mental health difficulties. It doesn't mean if the child has all of these things that they can't develop a mental health difficulty. Like I said with the risk factors, if they have these present, they are less likely. That's when you look at the data to support this, what you're seeing on here. And again, it's broken out into 4 categories: internal, family, community, societal. Again, a lot of these probably make good sense to you. So internal, do they have coping skills? Do they have normal physical development? Family is also very, very important, as you saw with the risk factors. But is it a supportive household? Are there clear expectations, clear values within that family? And just really feeling loved is really important, and we'll talk about that again later. The community, are they engaged with school or, the community in general? So, and just also feeling safe. Feeling safe in the society is also incredibly important. So this is, like I was saying, not an all-inclusive list on the previous slide and this slide, but these are just some things that you can really think about that the child or the youth may have that could really help them overcome and cope with mental health difficulties or in very stressful situations and just building that resiliency, which we will talk about again here soon. So with that, I think the next topic is going to be really important to everyone on this webinar. We've talked about the risk factors, the protective factors, why this is happening, what is going on in the data. So now we're going to get into the how, and Debbie's going to go over how to help your child. So Debbie, it's yours.
All right. Thanks. Yeah, so when we're looking at, what are we trying to achieve? What is the goal that we would like for our youth? And, the ultimate is to, have that positive youth mental well-being. So what is that? Here at Florida Blue, we define that it's an overall positive emotional state that's fueled by that sense of hope about their future. They're excited about what the future holds for them, that they're satisfied with their life. They have that relationship, which I talked about previously, that's that component, that psychological need that they still have an identity, that's in place, and that they have those skill sets, that they know what to do and how to adapt to life stressors. We all know that life, the only thing we can really count on is stress and anxiety that is going to happen, but how do we move through it, and how are we able to build up those skills to address what comes forward and keep standing up every time something tries to knock us down. That is our goal. So how do we achieve that? One way that we can look at building that is starting at home. I think as the teachers, as the guide for our children, that strengthening their skills and teaching them how to address what the world outside will have for us starts at that. It starts at home. It starts in their safe space. So some of those kind of key components is at the beginning, building and strengthening those relationships and giving them that accepting environment. Be open. Getting them to feel comfortable to talk about the small stuff and listening and truly engaging will help them feel more comfortable about coming to you for the more difficult conversations. So, always keeping those doors of communication open. Daily check-ins, that's something that I think truly is critical. I find it doesn't have to be long, sometimes 5 minutes, but just so that they know that you're here, that you're excited, that you want to know and you're engaged with them and invested in them. And wanting to know more about them is critical. It's something that I started even at a small age, giving me something to talk about. Or, you would get the common response, how are things? Fine. But keep pushing forward, asking specific questions. How was your day? Is there something you're excited about today? Is there something you're interested today? Are you worried about anything today? And just pausing for them to feel able to and share that information is important, just to touch base with what's going on with our children. Finding ways to relax, as we talked about, there is constant push to constantly do activities. School is ongoing. You think they starting classes as soon as they come home. There is work, there is homework, there is school activities, and when do they find that time to relax and decompress, which again is important to build up our own skills. And sometimes we might need to schedule that, whether that's scheduling family fun activities. Again, giving them time to feel like this is the time to relax. This is the time that we can be at peace and being able to do that. We've talked about, or I shared previously, about emphasizing their strengths. Every kid is not going to be able to achieve everything, but focusing on what's unique to them, what they find value is important to help build that reinforcement of what they can achieve. Not every child is going to be able to be successful in soccer. Not every child is going to be successful in mathematics. But if they have maybe better development in art and finding ways of building that strength, or how they are kind to their sibling or younger brother, might be ways of highlighting the strength and things that you want to build that positive mental well-being within them. Routines are critical, I think, is also important. Children thrive and they love routines and schedules. It gives them a way of identifying if they can't control anything else. They know that certain things are going to be happening. And things such as the pandemic caused that change in that routine, so that could be kind of some of that influx of issues. But a great thing is building routines at home. So again, they know in their safe environment, in their time at home, what happens. And then looking at yourself, and we'll kind of go over this a little bit more, modeling the behavior yourself, demonstrating to them that we're not perfect. Hands for, up right away that I, deal with stress, that they feel how that I am adjusting to it, whether it's dealing with issues with personal friends yourself, other family members. How do you adjust and train it? Because you're teaching them of how to address things as they are getting older and move on. So sharing those experiences, making them feel supportive and safe is important, and staying informed. They're so glad that so many of you are part of this meeting at this time, and this is ways that we are addressing that. finding ways to learn more information about what they may be struggling with so that we can be better informed to help reducing stigma, reducing what may be impacting them because we're now aware and able to have those conversations. So when you think about, we talked about the strengths that we want to build at home, but as you are working, seeing your child or seeing the children around you, there's things to be looking out for possible warning signs. These are just indications, and I think even though it's a very strong, long list, the biggest thing I think to highlight is that, really noting the differences of who your child had been and if you're seeing any changes in their behavior or what they are doing now. It's really critical. So these warning signs just may be experience that your child is having maybe some mental health difficulties. They're not a diagnosis. It's not used to diagnose mental health disorders. Everything is individualized and should be considered when you're thinking about how your child is addressing their mental health. But these could be symptoms or times when you need to be looking for ways to connect them with services, and maybe that a problem is occurring. Obviously, if there are some concerns such as self-injury or thoughts of or talk of suicide, definitely are times to bring in professionals, a doctor, school professional, law enforcement, etc., to make sure that the safety, because that's our number one concern with our children, is making sure that they are safe. If you are seeing that the children are showing more mental health difficulties, I think the primary thing to look at is finding ways to connect them with that doctor, having them talk to your primary care doctor. Mental health is just as important. There's no health without mental health. So just as important as our physical health is also explaining and having those discussions with a professional about the mental health or mental concerns. So our doctors are able to help connect and link us up with resources. There are therapists who are there to help talk through feelings and thoughts that may be coming through and giving our children opportunities of how to address or cope with them. They could give them coping mechanisms, helping them address when they are feeling this anxiety, depression, overwhelming concern and pressure that is placed on them, how they can successfully work with them with the right tools in hand. And then lastly, of course, if there's any concerns for safety, immediately seeking help. There are those two options with calling 911 in emergency situations or the National Suicide and Crisis Lifeline, which is 988. Again, available 24 hours a day, 7 days a week to have individuals there to support for any crisis conversations with experts there. When looking at resources, as we were talking about, of how to impact change is staying informed, and this is a great tool and resource that can have that information, whether it's our Florida Blue partners, Lucid Behavioral Health. They have a number of resources listed on their website that includes not only national and local services, but there's articles and references that talk about different concerns or behaviors that may be indicated, as well as National Institute of Mental Health has articles and reference guides. NAMI has information. Specifically for the youth, there is a mental health first aid kit, which includes, again, how to start conversations, how to help adolescents who maybe experience mental health or addiction challenges, and how to address that. So it's a great utilization to utilize when there are some concerns, as well as the Florida School Toolkit for Education to Preventing Suicide. So great, again, information, resources when you need to help support how to understand or how to do what's next for our loved ones. When I think about our loved ones, one of the things that is just as important is to think about yourself first, modeling that behavior, being mindful of how to help others. I always think about the airplane rule, which is that you can't help others. You have to place the oxygen mask on for yourself before you can help your children. So truly hold on to that. Finding ways, show through ways that you're going through, you're doing things to help relax every day, finding those me time, which can be struggling. I've shifted, for example, to finding time early in the morning. That's my sacred me time where it's quiet and I'm able to do things to help me relax. Sometimes it's taking that time to reflect, meditation, exercise, yoga, walking, reconnecting with nature. They're all super critical again, to kind of help improve your own mental health. So you're able to be there, that stable state for what's going on around you. And then always the things that are important, which is, eating, having that proper healthy nutrition in place and having that, and then having the adequate sleep. I know we did a presentation fairly recently, but that's just as important to have in place to have and to make sure that we are practicing our healthy behaviors as well. So lastly, I think to just hopefully iterate or kind of share with everybody is that being a parent is not easy, but it is very rewarding. I think that parents we are the teachers, we're the guides, we're leaders, we protect our cubs, and we are just our providers for our children. I think one of the things society has done in social media, even for us on the other thing, is that perception that we need to be perfect, that we need to do everything right. And there is no such thing as a perfect parent. I think the only thing that you can do appropriately is just be a real one. Be authentic, show your compassion, show your heart of what that is, and that will succeed and get you. I have lost many Best Mom of the Year awards and frequently, but then at the next opportunity, I acknowledge my faults, and hopefully that will teach my kids that it's okay to fail, but again, to stand back up and be able to move forward. And then the last thing, just to kind of highlight, I thought this was a great quote, that the best inheritance parents can give their children is just a few minutes of our time every day with them so that they can be seen, be heard, be supported, so they can continue to be a productive, positive individual and adult with the best mental well-being on the other side. So with that, we are concluding our opportunity to present these great information and insight, and thanks everybody for being part of the conversation. And I think at this time we wanted to open it up for questions.
Awesome. Thank you so much. Okay, so the first question that came in was, how do you suggest approaching or starting conversations with younger and older teens, especially boys, where it's not been a major topic of conversation with them before?
Yeah, if it's something that's never been started, I mean, you just think about starting either your family member, just walking forward, starting usually, it depends on what type of topic you're hoping to achieve. I mean, most kids become defensive automatically and regards come up if they say such things as, okay, we need to have a talk, so it's better to approach them with a place of positive intent is where I usually think of. So if you are dealing with such a thing as you're seeing changes in your child's behavior and you have concerns of substance use or other considerations, things like that, kind of coming at what you're hoping to, which is that loving place in the beginning, and saying that, I know this is difficult and it's sometimes hard in those conversations to allow silence, because they will use that tactic quite easily if they don't want to answer some questions. But I think that being comfortable with the science would also help. So, starting the conversation of why you're coming to them, what you've seen for differences, not accusatory, nothing along those lines. It's definitely a positive place that you want to see them doing better because you love and care about them, and being okay with being silent and hearing some of that quiet. And sometimes you might have to go back to that conversation multiple times. It may not be resolved, but letting them know that you may not want to talk about it now, but I'm coming back and we're going to continue that conversation.
Okay. Debbie, can you share your webcam again? Because I'm seeing Kim, but I'm not seeing you. And I know you guys wanted to be on webcam for the Q&A. Perfect. There you go. We see you.
All right. Forgot about that.
That's all right. Yeah. So next question was, are behavioral health providers also seeing increases in youth substance abuse, particularly marijuana use?
I can take that, Debbie. The quick answer is yes and yes on all accounts, and I guess I shouldn't be laughing, but unfortunately, yes, substance use has increased significantly. I can't recall the exact number, just know that it has increased. I will say that cigarette smoking has gone down, but now vaping is the issue in terms of smoking and things like that. But yes, marijuana use has also gone up along with really all substance use, unfortunately. And that's not just in youth, it's across the board. It's especially increased in young adults, which is 18 to 25, but in the youth, specifically for your answer, the answer is yes and yes.
Okay. We had a request come in, if we could, I'm just going to see if I can get back there. Go back to slide 2. Here we go. And with asking where those statistics came from.
Yes, it came from, let me pull up the exact name. 1 second. It is from the Youth Risk Behavioral Surveillance System, the CDC, from 2022.
Okay. Okay, I can also add that in the follow-up email if that's helpful for the participants today. I'm happy to add that link so you could look at that whole report. Okay, thank you, Kim. Next question, in terms of factors that have increased the impact on mental health generation, what about gaming?
Yeah, I think of, video games, online games, computer games, they've been around for quite a long time. I think with just like everything, it depends on the environment, how frequently that the children may be using that or being on there. If that's solely their life, that can obviously have an impact on individuals. So, just like most things, everything's in moderation at many times. I think things to think about as you're thinking about your child or, individuals working on gaming, kind of what's the input or what could influence them during that. Is it the images that they're seeing in there? Is it they can open up and be connected online with other individuals and the conversations that are happening as they are playing said game? That could impact them. Again, there could be bullying on that. There could be situations on that end. So I think in terms of for mental health, I think it kind of comes down to the kid and, kind of being mindful of what they should or maybe not be involved with. So it is dependent on individuals.
Okay. And I would also just add to that youth, just thinking, well, I'm not a parent, but I have nieces and nephews that I basically consider my children, right? But I will say one thing that I would be very cautious about in terms of online gaming when they can chat to other people is there have been circumstances where adults have taken advantage of children online from the online gaming community, whether mainly related to asking for money and stuff like that. So just be very cautious of some of those online chat rooms. That's not really mental health related, but I think that's just something that has come up again and again on the news and stuff like that. So that's just one thing I would point out about the gaming question. It's a good question.
Okay. Yeah. Next one, I witnessed the push demand for kids to be online for schooling in 2020, and it resulted in a significant increase / addiction to online usage due to that requirement. Has this push and its effects on teens been studied? And if so, where can we find the study?
I haven't seen that study, Kim. I don't know if you have. Great question. But to your point, everything. Oh, go ahead.
No, I was just going to say no, I haven't. The only thing I can say is like societal pressures that have already been being put in place. For instance, just like to get into college, how high your grades have to be, or there's such a push for college, and some kids, that's just not the right fit for them, and that's totally fine. But I don't know that specific, I don't know if that's been done or not. I haven't heard anything related to that. And I know, Debbie, you were going to say something else.
No.
Comment.
Okay. And then another question related to that was, because so much is online now, is there any data on homeschooling kids? Is it better or worse? I don't know if you guys have any thoughts there.
I mean, homeschooling has been, is different. I think there are some programs now that actually have an online capability, so that even if they're homeschooled, they can be connected with other kids kind of across, across the world, and they can do social events or social activities on there. So there is a lot of difference in there. So again, I have not seen a particular data set that highlights the pluses or minuses of schooling in either of those fashions, but I know homeschooling, because of online capability, looks different now than it did, I don't know, years ago.
Okay, and a comment came in saying, thank you for mentioning the game chat issue. My daughter was tricked into thinking she was talking to a 15-year-old boy, but the discussion was inappropriate, and the truth was learned when the person refused to turn on their video camera. So, yeah, very scary there. Okay.
And I think that highlights also as well just, our being mindful of what our kids are doing. It may seem overwhelming of why we're so engaged, but it's that protective factor I think many of us are trying to do, because it's a different world. People are catfishing or looking, setting up accounts to entice individuals offline. So being mindful of the different programs, setting up screen time, like how long kids could be on there, parental restrictions that are placed in there, things that we all are thinking about that, again, wasn't in place years ago.
Okay. So we had something just come in about when you were talking about the increase in the youth marijuana use. And it's person saying the reason this would be concerning is the reported incidence of psychotic behaviors, impaired driving, youth perceptions that marijuana is benign, an introduction to smoking and possibly of lacing with an even more dangerous substance such as fentanyl, saying that a teen in their town died from fentanyl-laced pot last month. And with that, are there any actual suggestions about how to approach this discussion with teens without sounding like a square or just an old, uncool person? Should we all just keep Narcan on hand and hope for the best? Even teens who are not habitual users are at risk.
I was smiling about the old, uncool person. I like that comment in there. But I do want to say this is a really important topic and something that I'm extremely passionate about. And I could do a whole seminar on it, but I'm not going to bore you guys with all of that. But you made many great points. There are a significant amount of studies that show if our youth or when someone younger uses marijuana, that it has been linked to an increased risk for psychotic disorders like schizophrenia or and bipolar disorder, which isn't necessarily a psychotic disorder, but serious mental illness, I guess I should say. So marijuana has been linked with some of those things, and the fact that it is increasing is concerning to someone like me that has been looking at the data, looking at the literature, and I'm really sorry to hear that a teen unfortunately passed away because of fentanyl. And if you aren't familiar with fentanyl, it is basically the new heroin. It's in everything. It's stronger than heroin, and it's incredibly dangerous. There's pictures out there. If you look, it's like a grain of sand in comparison to how much you need for an overdose when you compare it to heroin or oxycodone or morphine. And that conversation, I mean, it's a very delicate conversation. I think you should have the conversation even if you don't, like if you're like your child has no risk of that. I think just educating them on the fact that fentanyl is in everything. It unfortunately is finding its way into things, even in marijuana. I love the point, I think, I don't know, Patty, if you mentioned this point in the comment, but about carrying naloxone. I think it's great to have naloxone if you can, but I think
is that another name for Narcan, Kim?
Yes,
what you're saying
sorry.
is that Because the person asked about Narcan. Okay.
Yes.
Okay.
So, yeah, Narcan and naloxone are the same thing. Sorry, sometimes I get into pharmacist mode and then I forget that not everyone knows that. So thank you for clarifying that. But I think just having that conversation and keeping people aware that this is happening is the best thing that you can do for your youth, because if you think about it, I mean, think back to when you were young and, well, for me, young and dumb. My parents had conversations with me about this, and even though it was just a conversation, it made me double think when I was in those situations. So I think just having the conversation is the most important, and maybe you'll seem like an old, uncool person, but even if you feel that way, maybe your child doesn't, and it could save their life. So I think it's better to have the conversation and look uncool than not have the conversation at all. So great point, and thank you for sharing that. Yeah.
Yes. The sharing's been lovely in the Q&A. Next question: if a parent wasn't born with any kind of a disorder, depression, anxiety, from any trauma in life, would there be a genetic risk through pregnancy or birth? Meaning, if a parent was diagnosed in adulthood with trauma-induced disorders, would a child be at risk through pregnancy of that disorder or mental health issue being passed on?
Debbie, I can go first.
Yeah. Go ahead, please.
I'm just kind of digesting it. So you called, and I don't see the specific question, but it was called out specifically about trauma, right?
Right. It's on the right, Kim, in the backstage here.
Gotcha. So if you're saying because someone like you, the parent, the mom was pregnant and had trauma that happened while you're pregnant or something like that, that does not set the baby up for, let's say, PTSD or trauma-related disorder, because the trauma happened to you, the mom. I think if I'm understanding it, I think that's how you're asking it. But the other part, like, let's say before you were pregnant or even after you were pregnant and you experienced a trauma, whether it's an assault, a tornado or whatever it was, and you were later diagnosed with a trauma-related disorder, your child would not be at risk for that because the trauma didn't happen to them. But if you yourself have depression or anxiety, that child is higher risk for having those disorders. But trauma is a little bit different. And Debbie, I don't know if I'm answering it in a clear way.
Where I was thinking about kind of where we think about genetic or impact or anything like that, there's the biological makeup. So like, what is our physical chemistry? Some people may have a chemical need to take medication to address any depression or things that they have. So there's that side of our genetic makeup that can go from parent to child, etc. I also, and the other side of the coin is that trauma that may not have been a chemical imbalance or how you're, kind of being impacted by life, but how you are also a coping mechanism. So when you're thinking about a trauma and how you reacted to a situation, those become the way that you are working, or you are kind of having communication outreach with individuals, to including how you're raising your kid, that can lead to potentially maladaptive or inappropriate coping mechanisms. So, for example, if you had a trauma, significant trauma, where you don't trust anybody, and you become to the point where you don't want anybody to answer the door, you don't trust anybody that calls, you don't trust anything that happens, and you keep those statements and have those conversations over and over again with your child present, they may start internalizing some of those components as well, and that may be how they start addressing life situations. Not always 100%. Everybody is their own individual. Somebody, just because they are hearing things doesn't mean that they become that as well, but it's just an influence that we have on one another as they're going on through. So that, I don't know if that's truly answering your question, but I guess maybe it's saying that just because it happened as a trauma situation, there could be some things just from raising the individual that they may have those indications.
Okay. A question came in, can we separate youth mental health from youth physical health? In what ways might we be able to observe a connection if one exists?
And I'm not sure completely how it is, but I'm thinking like one of the things that we look at for mental health that you always are mindful of is, oversleeping. Too much sleep. That's a common thing that people think that when you are depressed, you're constantly in bed and no longer engaged. Well, during that youthful time frame, they are also going through a lot as their body is changing, as they're growing, hormones are occurring, maybe sleeping more. So I think where that connection is identifying, are they sleeping because of sleeping or is it concerning? So when I think about this, and Kim, I'd love to hear your side as well, is that it may not just be one indicator, but if you look at multiple things that are going on as a sign of maybe there's a concern that, if they are constantly sleeping, they're now, when they are awake, are secluding themselves and don't want to engage in activities they had before, those combined signs may give an indication there's something mentally that is going on. And I don't know if you had anything.
Yeah, I think the only thing I would say in terms of like treatment and things like that, if your child is struggling with a physical disorder or a mental health disorder or both, there really isn't to me, like there's not a separation. Like we need to consider all the things for anything. And the reason why I say that is because there are tons of studies and data out there that show if we do not treat the person as a whole person, they're not going to have good outcomes, because you're treating a person in two parts when you should be treating them as one. Because like Debbie was saying earlier, there is no health without mental health, and it can be reversed. So in terms of like symptoms and stuff like that, sometimes it's hard, and I don't know if this is what you were directly asking, it's hard to know if it's from a mental health disorder, is there a physical thing going on, and that's really hard to think about. But in terms of outcomes, we always need to think about the person as a whole person, and that's kind of a new way of thinking about things. Unfortunately, we separate our head from our lower part of our body, which doesn't really make sense, and that's been the norm for a long time. But now with all the emerging literature, it's very evident that we have to think about a person as a whole person. So, great question.
Okay. My grandson has seen a counselor, and they are recommending a psychiatrist. How do you find a good fit?
It comes to the individual, I think, is usually the thing. Like there are certain, when you think about anybody that you're going to work with, or you want to connect with that individual. So it's important to know, is there, that they prefer male versus female? Do they prefer somebody that jokes around with them more? Everybody is different. So it depends on what's the right fit, how they talk with them. You can have that conversation. You may meet a psychiatrist. It's okay if you don't like them and want another one. It's not like you have to be stuck with just one. So finding a fit is personalized on that.
Okay. Unfortunately, everyone, we're out of time. I am going to give all the because we had quite a few questions that we didn't get to. So I'll get them to Debbie and Kim, and we'll get the answers out to the participants. I want to thank everyone for attending today. Oh, we've got someone who said, no, give us another hour. That's so sweet. I want to be very respectful of everybody's time. We do have a short evaluation. You can either click on the link or you can put your smartphone camera up to the QR code. And we did get one question about what is Lucid and how do I access. So I put a brochure in there, and I'll put that in the handouts. It is an employee assistance provider. And so I don't know, I mean, we have people coming in from all different companies into this because we had opened it up to the community. So it depends on what company you work for and who the EAP provider is, but I did put a brochure in there if you'd like to learn a little bit more about them. And I'll make sure I put the resources in the follow-up email tomorrow. We'll get the recording link out. I did see a comment come in where someone had said that they had relatives who could really benefit from listening to this, so feel free. Feel free to, to go ahead and share the recording once I send it out tomorrow. So thank you all for joining us. We'll try to get everything to you as soon as Debbie and Kim have a chance to look at them and answer them. Oh, okay, so someone's asking about the participation certificate. I'll send that out tomorrow right after I send the follow-up email out. So if anyone needs that, you'll get that tomorrow. So thank you for joining us. Debbie and Kim, thanks so much. I think it was just a really good hour, solid hour of information for everyone.